Hi guys, my name is Sierra Dye, and today I'll be talking to you all about Alzheimer's disease and its current state in the U.S. So this is a table of contents going over what we're going to be talking about today. Summary of the disease, pathology, prevalence and risk factors, signs and symptoms, diagnosis, and treatment. So we're going to first start off with a summary of the disease. So what exactly is Alzheimer's disease? Alzheimer's disease, which I'll commonly refer to as AD, is a permanent neurodegenerative disorder that affects hundreds of thousands of people worldwide. It causes dementia, which is characterized as loss of memory and cognitive function. Even with all of the modern research and funding, there is still no cure, and the disease is irreversible. AD ultimately leads to your neurons degenerating and losing communication. Pathology. As I mentioned before, there is no cure, and we do not completely understand what causes Alzheimer's, but there are a few things that are linked to AD. Everything we feel, process, and think is a result of neurons in your brain firing and communicating with each other. There is a unique balance of chemicals and compounds in your brain that keep it functioning at a normal state. There have been two distinct proteins that are linked to the progression of Alzheimer's, and these are the beta amyloid protein and the tau protein. These two proteins become toxic to the brain when there is an accumulation of them. Abnormal tau accumulates in the neurons called neurofibrillar tangles, which is what you can see inside the purple neurons. Beta amyloid clumps form into plaques that accumulate between the neurons, which are those big brown and red things in between the neurons. Essentially, these plaques and tangles compromise the communication between the neurons. The first place that these accumulate is usually in your hippocampus, which affects memory so intensely. Your brain begins to not be able to communicate with itself. Next is prevalence and risk factors. According to the Alzheimer's Association, there is an estimated 5.8 million Americans over the age of 65 living with AD in the United States in the year 2020. This does not include worldwide numbers. Of that 5.8 million, 80% of them are 75 years or older. So here are a couple of the risk factors on the screen. So we've got ethnicity, sex, age, and family history. So as far as ethnicity goes, African Americans and Hispanics are twice as likely and 1.5 as likely to have Alzheimer's than elderly Caucasians. As far as age goes, the number of people with Alzheimer's doubles about every 5 years beyond the age of 65. And then about 1/3 of all people over the age of 85 have Alzheimer's. Women are statistically more likely to get Alzheimer's because they make up 2/3 of all AD patients. There actually appears to be no difference in the risk associated between women and men, but since women live longer than men, they're going to be statistically more likely to get it. For family history, your genes play a large role, especially if you have a first-degree relative who has AD. Most of our understanding is limited, but there is one gene that has been linked to increased risk for AD. The gene is called apolipoprotein E. It has alleles that have been found in the cytoplasm of your neurons. The presence of these alleles allow for further tau tangling in the neurons by binding to the tau proteins themselves. A few other risk factors associated with AD include Down syndrome. It's actually been shown that the extra copies of chromosome 21, there's 3 copies of chromosome 21, will increase a person's chance of getting it because in those 3 chromosomes, those 3 copies, there are the 3 copies of the gene that creates the beta amyloid protein. Beta amyloid itself is not toxic to your brain, but with more genes creating it, there's a higher chance to create those beta amyloid plaques. A couple other risk factors associated with Alzheimer's includes having a sedentary lifestyle, being obese, smoking, poor sleep patterns, hypertension, high cholesterol, and an uncontrolled type 2 diabetes. All these factors are also associated with heart disease, so by having better lifestyle choices, you can also decrease your risk to get heart disease. Next, we're going to talk about your signs and symptoms. According to the Alzheimer's Association, there are 10 signs and symptoms to watch out for that could mean a person is suffering from dementia or Alzheimer's disease. The 10 that they describe are memory loss that disrupts daily life, challenges in problem solving, difficulty doing familiar tasks, location or time confusion, trouble with spatial awareness, writing and speaking problems, loss of ability to retrace steps, poor judgment, being withdrawn, and changes in personality and mood. Many of these signs could just be age-related changes, but there are some differences in AD symptoms and then old age. For example, as some people get older, they might have a tendency to forget appointments or meetings, but they remember them later on. In someone who has AD, they may forget that these appointments ever existed. Another difference can be seen in routine and familiar tasks that are done on a daily basis, such as rules of a card game or driving to the grocery store. People with AD start to have trouble finding their way to these familiar places, getting lost on the way to the grocery store, not knowing where they're going, and maybe forgetting the rules of a game. One of the biggest indicators of Alzheimer's is when someone cannot keep track of the season, month, or even year. They might even think that they're 30 years younger than they actually are. This is very different from getting confused whether it's a Monday or a Wednesday. One of the hardest parts of watching someone degrade over time is the aggression and unfamiliarity they have towards a family member. As the disease progresses into the very severe states, they begin to not recognize their own grandchildren, children, or even their spouse. They become aggressive towards them and think that you want to harm or steal. Next, we're going to talk about how to diagnose Alzheimer's. Unfortunately, the only way to 100% confirm and diagnose a patient with Alzheimer's is to do an autopsy and look at the neurons of the brain post-mortem. However, the symptoms of Alzheimer's are usually very distinct. Diagnosing Alzheimer's early can be vital to giving the person proper care and education on what is going to happen to them. When a person starts having the symptoms mentioned previously, they should go see both a neurologist and a geriatrician. The doctors will then first review the patient's medical records and family and medical history. They will do a physical exam to determine blood pressure, mental health, and current medications. If the doctor believes that you might have AD, they will conduct a neurological exam that will show previous strokes, Parkinson's disease, tumors, fluid accumulation, etc., that could be causing the symptoms. They might also do a lot of imaging to actually take a look at your brain, just like if you were to have a tumor that would show up in that scan. There is also two different tests that could be used to further diagnose Alzheimer's. The MMSE and the mini-cog tests have been used. The MMSE gives you a score 1 to 30, 1 being a complete loss of everyday mental skills, and 30 being fully functional and having complete memory control. The mini-cog test is designed to test your memory through repetition of memorization and distractions. Next, we're going to talk about treatment. As mentioned previously, there is no cure for Alzheimer's disease, partly because we do not completely understand how it works or what causes it. However, if it's caught early, there are many medications that can help slow down the progression of the disease to limit the symptoms. There are medications called cholinesterase inhibitors that are given to patients with moderate Alzheimer's. The medication works by inhibiting the breakdown of the natural brain chemical called acetylcholine. Acetylcholine is a neurotransmitter that is involved in the learning and memory formation. Throughout its progression, Alzheimer's causes the brain to reduce its production of acetylcholine, so the drug does not work after a period of time. Another drug that has been used to slow down the progression of Alzheimer's is Namenda, or memantine. This drug is used for more severe patients who need assistance from a caregiver. This drug helps regulate a chemical called glutamate that only exists in your body in small amounts. If there's an excess of this drug in your body, it can cause your brain cells to die. Alzheimer's has been linked to actually increasing this chemical in your body, so the drug memantine will help regulate it to keep it at a lower level. So I actually have linked a couple of resources that can help you or somebody you know better understand Alzheimer's. and help maybe diagnose somebody who has Alzheimer's. If you see some of these signs in a family member, it might be helpful just to read through some of these approaches. A lot of information on genetic testing is located here, how to communicate with your doctors, and how to actually help a family member who is living with Alzheimer's. And these are my sources that I use to help get all my information. Thank you guys for tuning in and watching.